2, 1.
Good evening, everybody. Welcome to the meeting of the Health and Wellbeing Board, held today, Wednesday the 10th of March 2021 at 4:30. And a warm welcome to those who are watching now or those who may be picking it up afterwards. We're pleased to have you all here. We won't be doing introductions, but hopefully when people speak, they will introduce themselves, and you should be able to see the names at the bottom of the screen. I'm Councillor Carol Runciman. I'm Chair of the Health and Wellbeing Board, and I hold the portfolio for adult social care and health in City of York Council. So apologies. Are you doing apologies? Is it Linda or me? No, I'll do them.
Yeah.
Amanda Hatton sends her apologies, and Pippa Corner and Maxine Squire are here to represent adults and children. Mike Padgham sends apologies, and Bev Proctor is substituting on behalf of the care sector, and Lisa Winwood sends apologies, and Phil Kane is substituting on behalf of the police. So first of all, can I ask if anybody has any declarations of interest? No? Thank you very much, everyone. Minutes of the last meeting. Are those acceptable to everyone, or are there any comments on them? No, they're acceptable. I'll assume silence means consent. Thank you. So now we've got public participation, and I gather we've only got Stephen Crane. So Stephen, would you like to start us off?
Thank you very much. My name is Dr. Stephen Crane, and I work as a consultant in A&E at York Hospital. I'm attending the meeting today as a representative of many staff who I work alongside who are very concerned about the recent decision by York Hospitals Trust to allow Vocare, which is a wholly private for-profit organisation, to extend its influence and role in the management of patients presenting with urgent care needs to York Hospital's A&E department. Urgent care services in York are currently being delivered by Vocare for those with minor illness, but by the York Hospital Trust for those with minor injuries. Changes to the current situation have been proposed by the Hospital Trust to allow the management of patients with both minor injury and minor illness to be combined into an urgent care treatment centre, to come under the auspices of Vocare. Frontline staff working in urgent care, and in particular in the area of minor injuries work, are opposed to this plan for the following reasons. There should be no place for private for-profit organisations like Vocare to make a profit out of the treatment of patients with urgent care needs. We are concerned that having increased their influence over minor injury care, Vocare will want to extend this further into areas such as streaming and initial assessment of patients attending the A&E department. And this means that in the future, access to the A&E department in York may be controlled by those employed by Vocare, which is a wholly private for-profit organisation. Staff working currently in the A&E department are concerned that despite early promises to the contrary, that Vocare will eventually take over their employment contracts, and they will thus no longer work directly for the NHS. They're concerned that such contracts will not be as good as those NHS contracts that they've lost. And most importantly, we're concerned that ultimately Vocare will seek to reduce costs in areas such as training of staff, the complexity of cases they're prepared to see, and the time allowed for each consultation. And this will mean that the quality of care provided for patients with urgent care needs and with minor injuries going to York Hospital will be diminished. We believe that the people of York have a great respect for the public institution that is the NHS and for its staff, and there is no appetite at all for further outsourcing or privatisation of any part of the service, and multiple examples of cases in which involvement of the private sector has failed in the NHS. Allowing Vocare further influence over urgent care in York amounts to privatisation of part of the A&E department and is not in the interests of the patients of York. The specification for an urgent treatment centre can be met without recourse to the private sector, and there are multiple examples elsewhere in the country where UTCs are delivered wholly by the NHS. We'd be very happy to help develop such a centre with NHS partners in York. And we ask the Health and Wellbeing Board to promote the development of an NHS urgent treatment centre in York which is free from the influence of the private sector. Thank you.
Thank you, Stephen. We're unable to discuss that now because it's not on the agenda, and also the main person involved in it isn't unfortunately here at the moment. But it is something that we will look at to put on a future agenda, or even ask scrutiny to have a look at. So thank you very much for coming and sharing the concerns of yourself and all your colleagues. Thank you. Right, so we now go on with the items that are on the agenda. And the first one is the COVID-19 update from Sharon.
Yes, thank you. Thank you, Chair. My apologies to board members that I think the agenda might indicate that this was going to be a presentation. Instead, I'm going to give a verbal update, giving an overall picture of the pandemic in York. And then we have NHS colleagues, both the hospital and primary care, with us today, as well as TÜV, who I'm sure will be able to give an update in their particular areas. So York has had a cumulative number of just under 12,000 cases since the start of the pandemic. So that's the cumulative number of cases we've had. And that gives us an overall rate of 5,678 cases per 100,000 population. And that is lower than the national and regional averages. So the overall position for York remains quite positive. And the figures today for specimens taken up to the 4th of March gives York a rate of 45.6 per 100,000. And to put that in context, the national average is 62.8, and the regional average is just over 100 per 100,000 population. So York's rate is less than half of the national rate. At the moment, North Yorkshire has the lowest rate of positive cases in York. Their rate is 43.2, and we're the second lowest in York, with our rate of 45.6. One of the areas that we particularly look at is what's happening with people over 60 in York. We're particularly interested in the over 60s because we know that age, together with associated existing health conditions, can have the greatest impact on people becoming more sick with COVID if they become infected with the virus. And I'm really pleased to say that the over 60 rate in York has come right down. That is now 24.2 per 100,000, which is the lowest rate in Yorkshire and Humber, which is 38.8. So we have a very positive picture in terms of our over 60s. Of course, we'll talk about vaccination a little bit later on. I'm sure that our primary care colleagues will be able to give us an update on how the COVID vaccination programme is going. And that, of course, will have had an impact on the older population and will have reduced the risk of serious illness and hospitalisation. And so I'm sure the vaccination programme will have had a positive impact on the case rate with our older population. When we then look at what's happening within York, we currently have 9 electoral wards that are above the national average. So the part of the city that has the highest COVID rate at the moment is Strensall, and that has a rate of just over 168 per 100,000. That's the area of York that has the highest rate. But we have 3 electoral wards with no positive cases at all. So what we're seeing is a variation emerging in the pattern of infection across the city. Our testing program, our COVID testing program, continues and has a very high take-up. And when we look at the number of positive cases being picked up through our testing program, the number of positive cases being picked up through PCR testing. So these are people with symptoms of COVID that are going to one of the 2 symptomatic testing centres we have. That rate has now fallen to 2.1%. That's a little bit lower than the national rate, but half of the regional rate, which is 4.8. So that kind of gives you some idea of prevalence of COVID in York. And then, as colleagues will know, we've been rolling out a community programme of lateral flow testing. And the positivity rate we're picking up through lateral flow, that's the symptom-free testing, is 0.2%, which is very similar to the national and regional rates. All of our positive cases in York now are estimated to be due to the UK variant, the Kent variant. But so far, we've not had any cases of any of the other variants of concern in York. So that includes the South African and the Brazilian variants. We haven't had any cases of those. In terms then of where we're seeing cases in settings, we're doing very well with our care homes at the moment. We just have 2 care homes that we're dealing with that have had outbreaks. And we currently have 34 children of primary and secondary school age that have been picked up. And that number is increased really due to the school testing, which began to be rolled out last week, where children have needed a test before returning to school. And then there'll be ongoing twice weekly testing offered to school age children. So what we've seen in our local data is that the positivity rate in children has increased. And that's also been a picture that we've seen regionally and nationally as well. That isn't unexpected. We expected to see a rise in cases in that age group. And it's one of the reasons why the national lockdown restrictions are being lifted slowly. And so the schools opened this week. There's now another 5 weeks before other restrictions are lifted, and that is really to give us an opportunity to understand what happens as restrictions start to be lifted. We're able to identify positive cases through testing, and then can put in our local outbreak response. So that's part of our outbreak management plan. Hospital admissions are also falling due to COVID, and I'm sure that Simon will be able to tell us a little more about what's happening in the hospital in a moment. In terms of COVID deaths, we've had a cumulative number of 300 267 deaths in York, where COVID has been recorded on the death certificate. That gives us a death rate due to COVID of 174 per 100,000, which is considerably lower than the national average, which is 215. So overall, we've done, even though each COVID death is obviously a very sad occurrence, what we've been able to see in York that our deaths are lower. So that is positive picture overall. The average range of the number of people that have died due to COVID in York is 82 years, with an age range of 44 to 104. And the number of deaths that we're seeing at the moment is falling. We saw a peak through as a consequence of the spike in cases that we saw through December, January. We saw a peak of 32 deaths a week just a few weeks ago, but those have now considerably fallen, and we're seeing less than 5 deaths during the most recent week, and so that's very positive. In terms of our contact tracing program, we're seeing over 90% completion through contact tracing of people that have tested positive through our local partnership with NHS Test and Trace, which is also very positive and is obviously helping to keep our numbers low. So just in summary then, our cases are generally falling across all age groups. We fully expect to see an increase in cases in school-age children, but then after that initial spike, we would expect to see those numbers start to fall. Our schools have very well-tested arrangements in schools to be able to prevent the spread of infection, and those measures alongside routine testing will enable us to pick up any cases associated with education settings very quickly and be able to respond to those. The government has published its roadmap out of lockdown, which I'm sure everyone on the call and anyone watching will be aware of. I think it's worth mentioning the 4 tests that the government has set to monitor whether those national restrictions can be lifted with a timescale that's set out in that roadmap. So those 4 tests are how well the vaccination programme is going. We know that the programme is going very well in York, and so I think we will have passed that first test very well, but obviously we don't have local lockdown restrictions anymore. These are national restrictions. And so the government will be looking at the effective rollout of the vaccination programme nationally. The next test is evidence that vaccination is reducing hospitalisation and deaths, so that the vaccination programme is working then in effect. That infection rates do not risk a surge in hospital admissions, which would then put pressures on the NHS. One of the reasons that's there, it's important to say that not everyone will be vaccinated. We know that the vaccination programme is being rolled out by age, and that's rapidly being expanded, but it's going to take some time before every adult in the country is offered vaccination. And we know that not everyone will be able to have a vaccination, either for medical reasons or because people choose not to take up the offer of a vaccination. So we'll be continuing to watch very closely what happens with infection rates. And then the final test is the government's assessment of the risk from any new variants of concern that emerge. So constant monitoring of new variants and the ability of the vaccinations that we have to be able to protect people against those new variants. So those are the 4 tests that the government have put in place. So even though there are dates in the roadmap, those dates are not fixed dates and can change dependent on what the picture is around those 4 tests. So in terms of...
I think you're going to have to stop soon, or everybody else won't have a chance to say anything. Is there anything else crucial you need to add?
I was just going to say, really, that our next steps in York are we are required to refresh our outbreak management plan. So we're in the process of doing that, and that should be signed off by the Outbreak Management Advisory Board at their April meeting. Obviously, restoration of NHS services is a key priority for us going forward. And then also looking to the wider recovery of the city and economic recovery are areas that we're particularly focusing on at the moment. So I'll finish there.
Lovely.
Carolyn.
Thank you very much, Sharon. That gives us a very thorough picture of what's going on. So if I now pop round for some relatively brief comments. Steph, we talked a lot about vaccinations. Can you talk a little bit about that from your perspective?
I can, thank you. I'm Stephanie Porter. I'm the Director of Primary Care at the Vale of York Commissioning Group. Our primary care colleagues and hospital hubs have been delivering the vaccination programme really well in collaboration. You perhaps be aware that we are doing it in age group. So I can tell you that those aged 65 and over, all the way up to however old, we're vaccinating in the region of 92 to 97%. So as Sharon alluded to, we'll never get to 100%, but they're pretty impressive figures. Age brackets between 60 and 64 were about at 70%. And then we're moving through the age brackets and anybody with additional eligibility criteria. And we're about at 30% for the over 50s. And the national booking service is open to 55s and over, so we're doing really well, and we're just about to start with some fairly sizable work programs to get second doses into care homes. So we're on track, and we're you know, pretty pleased with the progress of the vaccination service.
I'm sure there'll be questions from people, but can we save them until all the speakers have completed what they have to say, please? Nigel, can you do it from the primary care perspective?
Yeah, of course. And you've got 2 medical opinions in the room as well. So I'll probably bring Emma in quickly to give an opinion as well, if that's okay. I thought I would add a perspective really around waiting lists. And of course, the waiting lists around the UK have increased, and it's the inevitable given the need for the NHS to respond to the COVID pandemic. And, you know, remember the great work that's been done to open up capacity to within our hospitals and all across our sectors to dedicate the work to the COVID response. But understandably, as the sort of surges subside, then the long-term impacts of the waiting lists start to come through. And now we know that there are many thousands of people, friends and families and loved ones that are actually waiting on lists across the country. So quickly, I was just thinking that I could break that down into 3 things, which is the referrals coming in from primary care. Waiting well is what we're calling waiting well. And maybe the most important thing for me, which is prevention. So in the referrals bit, and Emma might want to come on this later on, is that we did see an initial reduction in patients coming through to primary care. You will have remembered that in spring and summer of last year. And then there was a subsequent reduction in referrals from us into specialised services. Primary care got its bounce back with activity in late summer and autumn, and now activity is back to or more than it ever has been before. But referrals, interestingly, are still down, and there's work happening regionally and locally to work out why that is. And it's important to state that there's been a lot of work done locally about communication about accessing services for suspected cancers. And that's really important for me to emphasize again, that if people do have lumps, bumps, unexplained coughs and so on, that they must get in touch with us. And another angle to that with the referrals rates reduction is inequality within the systems. And we know that certain groups of residents are even more hesitant to come forward. And unfortunately, those are the people that have the biggest health impact and the biggest negative health impact. So it's really important that we understand that and get to that as a clinical and as a society. Just quickly moving on to waiting well is a term that we're starting to use about those people on the waiting lists. And Simon might want to come in on this on his bit about those big waiting lists and what we can do whilst people are on those waiting lists, and how we wrap around services from the community and voluntary sector to get to patients and people's needs whilst people wait. So I'll leave that bit there. And the last bit, I suppose, was to remind people that prevention is better than cure. So just as we get our boilers serviced and we test our smoke alarms, please think about getting your dental checkups, your eye checks, your blood pressure checks, because those are really where we need to stop things happening to ourselves and our loved ones as we go forward. So it's just a thought about prevention. I don't know whether Emma's got anything else that she would like to add.
Emma, do you want to add anything?
I guess there was a few comments, Chair, that I just wanted to make. Firstly, I just on the back of Sharon's report, I think we've actually got a lot to celebrate. Whilst COVID has been an absolutely devastating pandemic, of course, actually in York, I think what we can celebrate is we've had a really good working relationship between the hospital, primary care, the voluntary sector. We've come together and delivered this record, fantastic COVID vaccination programme. And I guess I would like to say on behalf of my primary care colleagues, what a fantastic job they've done. The volunteers, the people that have done extra shifts, worked 7 days a week to deliver this, along with the volunteer programme, has been outstanding. And York has really come together as a community. So firstly, I just wanted to say thank you to everybody that's been involved. It's been an absolute superb success, and I think York's got a lot to be proud of. Just wanted to mention as well, I might be chipping in before Alison gets there, but York CVS have also done a fantastic effort in supporting our patients, particularly our vulnerable patients with COVID, and I've been offering monitoring support for them, which has been invaluable to primary care to allow us to crack on and see patients with health problems, whilst knowing that our patients that have got COVID and going through that very frightening illness have been supported. And more latterly, they've also rolled out the oximeter programme, so those at risk of more respiratory illness than others have now got a little probe that they can monitor their oxygen levels. So just a real celebration that York has been really pioneering, has got ahead of the game and has delivered some really fantastic work. I guess what Nigel was coming on to, that obviously we can echo as GPs in the area, is obviously the concerns of the long-term impact of this pandemic, and particularly obviously about the waiting times. And again, I'm probably only going to echo what you've said, Nigel. I guess my only other one I would ask as a women's health lead would be to encourage smear tests, because again, smear tests are all part of that programme. We're doing a lot of work and social media work around the York community to try and get better self-reporting. So it's the campaign Help Us to Help You. So the more that patients can monitor their own blood pressure, they can take pressure off us, so that we offer our bespoke services to those harder to reach and those who need our care in a different way. So those who are able to, who can, have long-term conditions like hypertension, high blood pressure, if they can monitor their own blood pressure, help us, give us those readings, take the pressure off our appointments and allow us to keep an eye on things. So a big plea to do that. And just the other thing probably to mention as well is about what we're doing about the more vulnerable communities, because obviously health inequalities is something that we're all here to champion. I think we're doing a lot of work around the learning disability community, which is something, again, we're all very passionate about. One, about just trying to improve health checks, because what has been very startling for us in primary care is seeing the amount of very serious illness in the LD groups that is being left too late, partly out of fear for coming forward, but also just about the fact that the closed door services are possibly turning the wrong people away. So we're really pushing in general practice to try and get those health checks done. But equally, with regards to the COVID vaccine, we're trying to make a more bespoke offer for those, because whilst we've got this brilliant hub that is turning around huge numbers every day, we do appreciate certain communities need a different approach. So LD is in particular one, and I know that families of autistic children will also say they need, and autistic adults will need a different approach. So we do have to look at certain communities and see what we can do to help them, and that goes across everything, COVID vaccine, but also long-term conditions and just general support for them. And again, just to celebrate, we've done so well with the housebound and the nursing homes, which were so devastating at the start of COVID. So to have a third of our nursing home population died within a very short period of time, it really was so startling for us. And then we feel, I think, very proud that we've now got nearly 98% coverage of our nursing homes vaccinated. So I think it's a real celebration. We've done really well as a community. We came together very quickly and responded. So again, I just obviously want to thank all the primary care colleagues who've really worked hard, along with the support of the volunteer army, public health, to get those vaccines out. So thank you. That's my comments.
Thank you. I'm going to ask Simon and then Maxine and then Alison. And then if anybody else wishes to contribute, perhaps they could indicate or put something in the chat so I can pick it up. Simon, would you like to talk from the hospital's perspective?
I would, thank you, but only very briefly. Much of it has already been said, and Sharon did give a very comprehensive update. I suppose to start with, I'd just like to echo Emma's point about how well as a city, and I would say from our organisation's perspective as a broader system beyond York as well, that we, how well we've worked together to manage this pandemic. As I think I pointed out at the last meeting, in this second wave, we've been particularly badly hit in York in terms of York Hospital, and our numbers, our peak numbers, were not too far off double the peak in the first wave. But they are coming down, so reflecting Sharon's message around the reduction in prevalence rates. Looking today at our numbers across the trust, we had 48 COVID positive patients. It's come down slowly, and it is still only coming down slowly. So that 48 has only fallen sort of 20 or so in the last 2 weeks. So we haven't seen it fall dramatically yet to the kind of levels that certainly I would like it to be at. And it's still been stubbornly high in critical care. That's been one area where the reduction in numbers have been quite slow. We've got 6 patients in critical care at the minute. But because our numbers are starting to come down, absolutely, as Nigel, Emma and Sharon indicated, we're now starting to turn our attention to recovery. And we will need to work together with colleagues in primary care and the voluntary sector and community services to do that effectively as well. And Nigel alluded to some of the work that we'll be doing around those patients that are particularly waiting for a long time on the waiting list, and how we might think about how we might wrap around some support for those patients. The other point on recovery I wanted to make, and again it covers all sectors, is we absolutely need to think through how our staff recover from the pandemic of the last 12 months, and that's making sure that we properly recognise and acknowledge the contribution that people have made, but also make sure that we put the right kind of psychological support in for staff going forwards. And again, that, as I said, that isn't just around hospital staff, that's looking to primary care, social care, voluntary sector, a whole range of people who've been involved in dealing with this particular pandemic. I'll leave it there.
Thank you very much, Simon. That's very helpful. Maxine next.
Yeah, again, I just want to build on what Sharon and other colleagues have said, which is to celebrate some of the successes that the city's had throughout the COVID pandemic. And one of the key ones is the strong partnership that has been between the city's schools and education providers and public health, and they have benefited greatly from the local public health advice that they've had. Certainly some of our academy chief executives have spoken about the fact that they've had much stronger support in York than they've had in some of the other areas where they've got schools as part of their academy chains. So it's been noticeable that the response has been very, very strong. Obviously, we've had the full return to school on Monday, and today 95% of children are back in classrooms, which is significantly higher than the national average, which is 76% today. We've had no need to phase the return to York schools in the way that some other areas have. And that again is a tribute to the hard work that our teachers and head teachers have put into getting children back into school. And they very proactively in our secondary schools started the process of getting the tests done from the 1st of March. And they're very grateful for the fact that the community sites have supported them with their school testing sites, so that they've been able to get the throughput of children through prior to the return to school. So very successful, as I say, in terms of the strong partnership working that's been taking place. Just in terms of staff tiredness, we've also got a lot of very, very tired school leaders out there at the moment as well, but they are absolutely delighted to see all children back, and will do everything they can now to make sure that things go smoothly and that they're putting their recovery plans very actively into place. And I'll leave it there.
Thank you very much, Maxine. I'm going to take Alison, Naomi and Sian, and then have a few minutes for questions. Alison.
Yeah, so I won't rehearse what's just been said, but totally agree with all the great partnership working that's happened, which I think will stand us in good stead going forward, because we absolutely need that, because we've got huge problems coming our way. And I think Naomi will probably tell you about some of the mental health challenges that we're facing. I mean, obviously, just to point out that inequalities have been exacerbated during this pandemic, and we really need to focus on getting those people that haven't had the support they need back on track. So I think that's my area of concern. But yeah, I'm going to leave some more for Sian to say, because I think she's going to come on after me about some of the challenges we're facing at the moment. I'll leave it there.
Okay, Naomi next.
Hi, thank you, Chair. I just thought it might be useful to update the board on some of the demand issues that we're now seeing in mental health. I think we shared a presentation earlier to this board about the forecast and the expected surge in mental health that we were predicting. I think we're now starting to see that, and demand is across all pathways, but there are particular areas of concern, particularly in relation to children's eating disorders, and that's been mirrored nationally. And it's also worth highlighting that there are significant inpatient bed pressures now across mental health trusts, again, in our trust, and I think, again, also nationally. So some of the system approach to meeting the need in the way we did with COVID and having that partnership and taking that learning may well now be needed in response to mental health. Staff are understandably tired, as has already been echoed by others, but now in mental health with them, we may need to respond further, which will be a real challenge for us. Staff and sickness levels are currently very good and in line with where we'd want them to be, although we may have an impact from schools returning, and the staff vaccination program's been very positive.
Oh, good. Very good. Right, Sian is the last one who's going to give an update, but I just want to acknowledge that what Phil has asked us about recovery is something that I think we should put on the next agenda. I think it's too important, Phil Kane, sorry, to shove it into a corner. I really do think that that is, it really is a subject for fuller discussion, Phil, and thank you for bringing it up. Right, the last speaker then, Sian, before I take questions.
Sorry, I feel like I'm leaping in. I'm not going to give an update, but I did want to sort of pose a challenge back to the board that part of what we've done so well together is work through challenges collectively. And one of the issues that we are picking up is around people with learning difficulties being able to access the vaccine site, and the potential solutions we have at hand for that. Actually, there are many reasons why those aren't suitable. So I think one of the things I would like us all to think about is how we could collectively work through that issue to make sure that people with learning difficulties can access the vaccine. I think there might be multiple solutions to that. I think it's not beyond our wit, but I'd like to have a proper conversation with some of the board members about how we address that quite quickly, because we're expecting, as the rollout continues and people with severe mental ill health are also invited to come and take the vaccine, we may experience exactly the same issue that we're having now. So really, really keen to kind of have some conversations about sorting this out.
Sean, is it something you should discuss with Steph outside the meeting?
I think it's definitely a conversation that we can have outside the meeting, but I think it's one of those things that actually the excellent partnership working that we've seen during the pandemic gives me faith we can fix this. And I think it's good to acknowledge some of the challenges that are still facing us and think about positive solutions to fixing them. So just wanted to bring that up, that we're getting a lot of feedback about that. And I think it's useful for the board to be aware and for us to come together to get a solution.
Yes, thanks, Sean. Right, Denise has got a hand up. So Denise, you may be the only question because we're running out of time. Oh, Anna's got a hand up as well. Right, okay.
I'll keep my question short as a question. Yeah, I mean, people have obviously started to touch on this, but when I put my hand up, I was thinking particularly in response to the issue about waiting times that was raised, how that's applied to waiting times for mental health treatments, for both assessments and therapies specifically, and what sort of impact we see for that going forwards. And I suppose in the spirit of what Sian's just said, what sort of focus we could bring to that.
That's probably a Naomi question. We'll just have Anna's question, then we'll have the two questions answered, and then we'll have to move on to the next item, I'm afraid. Anna, would you like to ask yours?
Thank you, Chair. I just wanted, and it's probably a question for Maxine, and I should declare an interest at this point as my husband's a teacher, but we hear a lot about transmission, obviously, for children going back to school, but can you just give us some reassurance about what measures are being taken for all the staff that work in schools as well, because obviously they're now in an environment where we talk about increased transmission rates amongst the children that they're coming in contact with?
Yeah, obviously all school staff now do home testing twice a week, lateral flow testing, but throughout the pandemic, the schools have very thorough risk assessments in place, which mean that they operate a series of controls, which means that staff are encouraged to stay within specific areas of the school to reduce the amount of mixing that they do, adult to adult. Staff rooms, their use has been discouraged. There's regular cleaning of the areas that they're in. Obviously, if you are in a secondary school at the moment, then all head teachers have made it mandatory for face coverings to be worn within the classrooms, and also have asked staff to keep their distance as well as much as possible from children. So it's difficult for staff because they're not used to teaching from the front. It's not their preferred style, but they're going back, they're having to go back to doing that in order to keep that extra distance. We're making sure that any staff that need individual risk assessments because of underlying health conditions, that they've actually been put in place for them. And they receive very thorough regular updates from the health and safety team about additional controls and measures that they can put in place. And our colleague from Public Health, Anita Dobson, who is the nurse consultant Public Health, is invited very regularly to the meetings of the York Schools and Academies Board so that she can provide them with updates on the latest information about suitable controls within school environments. So a lot of very detailed work that goes on.
Thanks, Maxine. Naomi, could you respond to Councillor Craghill's question?
Apologies, could you restate the question, please?
Denise,
Yes,
I've
okay.
also got an unstable internet connection as well. I do
Oh,
apologise.
right. Okay. Yes, I was just saying that we've had the question raised of waiting times of the input, you know, now coming forward, getting worse. And I wanted to ask about the impact of that on mental waiting times for mental health services, for assessments and therapies. You know, how much worse might that get, and how are we going to address that?
Yeah, I think there are key areas where it's impacted more. So obviously mental health services didn't stop during the over the last year. So in most services we've been able to maintain the 4-week waiting time, which is what we work towards for referral to assessment. Where we have had extended waits as a result of COVID have been in 2 key areas really. One in relation to say autism assessments, because we couldn't do anything as an alternative, so there were no kind of alternative digital offers or digital assessments that could be implemented during that time. And also in relation to memory services, some of that in relation to people changing the behaviours and whether they actually wanted to come in and see us and go for the tests that perhaps they may need to support that diagnostic pathway. So there are key areas that were negatively impacted. We're at the moment working up plans around how to address those additional waits, changing the way, particularly in York, we work into memory services to try and improve the diagnostic rates. Been working in partnership with CCG colleagues to see if there are any other creative ways as well that we can do that, and looking at further roles, perhaps through dementia care coordinators as well. For children who may need the say autism assessments, we've put in some kind of safety measures so people can come in and have those face-to-face assessments that are required. And we're also looking at how we can invest into that service in this year to improve capacity and reduce those waiting times.
Okay.
Thank you, Naomi. I just want to say about the care homes. Bev has put something in the chat, which I will now find. And she says, massive success with vaccinating and testing. Thank you to everyone. 1/3 of the care homes population's passed away, but we remain focused on increasing vaccine uptake with colleagues whilst remaining vigilant, careful and cautious as we work through the easing of restrictions. Visiting restarted this week. She says it's been very hard for the sector and there's a very tired workforce. And I can absolutely believe that. They really have been working around the clock. So thank you, Bev, for that. And I'm sorry we haven't got time to take you speaking about it. Right, I'm going to move on now to the plans for the future of the health and care system in York, which is a presentation. And I think Peter Roderick is going to do this, possibly with Phil Metterman, Sharon Stoltz. So whoever's going to start, would you like to put your screen up and start us off on this one?
Thank you, Chair. I'm starting, or rather, sorry, Phil is starting, but I'm sharing. So Phil, if you're there, I'm going to share the screen now. And if Councillor Runciman, are you able to just tell me if you can see that?
Yes, indeed.
Lovely. I'll let Phil start.
Thanks, Peter. And hi, everyone. Thanks for giving us some time this evening. I don't feel as though I have exclusive rights to present this, as many colleagues on the board are either as knowledgeable and or involved. So Sharon Stoltz knows as much about this as I do, and Simon, Emma and Alison and maybe others have all been directly involved in what we're going to describe to you. So we can all have a conversation about that shortly. There are 5 or 6 slides here which explain the background to this. And this relates to the white paper which the government will be taking forward for its first reading in May second reading in June, which creates a new statutory body within the NHS partnering with local government. These things are called integrated care systems. I'll talk more about that in a moment, but the emphasis of the white paper starts to change the way that the NHS works, in that it involves a duty to collaborate both within the NHS, but also across other sectors. You'll know that in the past, the NHS has operated under a principle where sometimes competition has been encouraged. So it's moving the NHS to a new way of working. That new way of working will start in earnest from April 22, but locally we're expecting the white paper to pass through Parliament, and therefore we want to use this next year, 2021-22, to prepare for that. And the period that we've just had with COVID has suggested to us that we're well placed to collaborate in a way that has suggested to us we can do things far quicker than we ever realised. We've always collaborated, but we've really got on with things. And the conversation that I just heard then about vaccine and other developments are examples of that. Next slide, please. So the white paper will establish, we think, 42 integrated care systems across the country. The Humber Coast and Vale is one of the larger of those. It may be in time that number will change, but we can expect Humber Coast and Vale to continue. And as part of this change, the Vale of York CCG, which currently holds the statutory duty to receive financial resources from the Treasury that relate to the healthcare resources for the citizens of York, the Vale of York CCG will be disestablished from the 31st of March 2022. And so what we are proposing to do in this environment of collaboration is to create something that brings together the NHS and other sectors in York that by April 22 would be mature enough to receive financial resources that relate to the care of the residents of the city. And the terminology and language that is being used for that sort of development is to describe York as a place. I know that sounds a bit basic, but within the wretched terminology that we like to use within the NHS, that's pretty straightforward. So I think we'll probably take that for now. Next slide, please. Thank you. And I'm trying to get my camera on. I don't know whether, Carol, can you see me? I can't see me.
No, I can't.
I am here.
No, I'm looking at the slides and Peter at the moment.
Okay, I will try and sort that as I'm talking. So
I know what you look like. Most of us do. So.
Okay, the implication is there. Keep your camera off. So yeah, I'll take that in the spirit that it was offered, Chair. So we are proposing within York then to take forward this principle of collaboration within a place. And we're going to do that by trying to establish something by April 22, which we are calling the York Health and Care Alliance. And that alliance will take on some of the responsibilities that previously within the NHS, our providers and the commissioners have done more separately. They've talked with each other, but they've often not been as encouraged to work to an integrated model as we are now being encouraged to do. So we're now starting to think about how we could and should do that. Next slide, please. Next slide, please.
We're stuck again.
Apologies, Phil, we seem to be stuck on this one, but there we go.
There it is. Yeah.
Thank you. So within this York Health and Care Alliance, we are proposing to create a form of shadow governance from next month to get ready for April 22. The organisations on the slide there are those that are involved. As I suggested at the start, some of the colleagues from this meeting involved personally in that. What we're trying to create is something that is different. And at the heart of that is creating a dispersed leadership model that means that those leaders take as much responsibility for York as a place as they do for their own organisation. And we start to then develop as leaders and individuals within York. So creating a very different way of working. And we want this to be perhaps less dominated by the large statutory organisations than we might have seen in the past decade across York and more widely. Next slide, please. We're a bit stuck, aren't we? Let me see if I can.
There we go.
Thank you. So I think this is the last one, and then from me, then Peter, I think, is going to talk about how in collaborating together and working to this dispersed leadership model and focusing very much on the city of York, we can put the people of York at the heart of what we do. So Alison may talk in a moment or two about how we've asked her to create a call for action for local people to get involved in this, to help us understand how we make a difference at neighbourhood and community level in a way that we haven't seen in the past decade. So we are looking for a change that we haven't seen for a generation here. We do think this really can be exciting and make a difference. And so we are trying to get to an offer for local people that will be more integrated, so that the people of York will have an offer where they do things in a way where perhaps they've seen different professionals on different days in the past. We'll have a far more integrated way of delivering that offer than we have previously. And in doing that, we should make it more bespoke to where people live and what their particular problems are themselves and with their families. And we should therefore be more efficient in how we do that, and therefore create easier and more timely access with better outcomes for local people. The expert on using data for that and how we do that is Peter Roderick. And I think Peter's going to tell us now how we do that. And then Carol, if there are any questions or a conversation, very happy to have that at the end of the slides. Thank you.
Oh, that's lovely. Thank you very much, Phil. All right, we hand over to Peter.
Thanks, Chair. 3 slides from me then. The workshops that have been held as we've been preparing for the start of the Alliance in its shadow year, we've tried to focus as much on sort of obviously the relationships between us as partners and what we're looking to achieve, but as much on population health need and what we know about York. And this slide just tries to sum that up in some ways, how we move from what the platform for change is for our city. So the number of things that we list along the top row there that we know about York's health. This could be a very long list, but almost some highlights, thinking about the fact that in line with other areas, and in fact nationally, as Michael Marmot has pointed out in the UCL reviews, the healthy life expectancy, which was changing and improving across potentially 50, 60 years in the UK, that improvement has really stalled, and it's stalled in York as much as it has anywhere else. And we're now seeing, particularly in our most deprived groups within the city, life expectancy and healthy life expectancy reverse, and in some sections of the population decrease. And COVID has impacted upon the population's health, as we've spoken to today, in a multitude of ways. We have demographic changes, we have economic changes to the city, and we have your common or garden preventable ill health conditions, which we've still not cracked, even though we may have made some improvement on them. So 1 in 10 of the population smoking, 2 in 3 adults who are overweight or obese, and 1 in 7 people in York living with depression. So if we think about that as a platform for change for York, if we want to identify the things we really want to change in the population's health and the improvements we want to make, we go on to the middle, which is thinking about the outcomes. And in many ways, we take what we've already got set for us as partnerships, and the joint health and wellbeing strategy that this board has ownership over has identified possibly the best way really of articulating that is to think about a life course, a start well approach, a live well, an age well approach, but then particularly thinking about our challenges around mental health as well. As part of that, the proposal is that this is the outcome framework really that we work to as a city. But we need to define some areas that the Alliance across this next year is going to try and make a difference on and start this new way of joint working. And so we have set some areas of first focus where we think we've got quite good opportunity to join up work between areas. These are areas which are not just medical areas of health improvement, but have social aspects too. So you can see them in the bottom left-hand corner. Improving the number of people who are able to achieve and maintain a healthy weight, and reducing the number of people with a diabetes diagnosis or the incidence of diabetes, better meeting the needs of people who have learning difficulty or disability, and people who have autism, and the people who in York receive packages of care because they often have complex needs, where various organisations fund those packages or various organisations provide them, and we think there's a real chance to integrate those packages of care better. And then there are some other key areas of action which we must reflect because of what we know. Partly this is COVID and COVID recovery, but we know that alcohol is a population health issue for us as a city, as are suicide and self-harm, dementia identification, and then the care of people who have a dementia, loneliness, isolation, well-being, particularly acute because of COVID and lockdown, childhood resilience and child health in general, and community mental health integration. The next slide describes a little bit about the governance of the Alliance, and just to explain this a little bit, during the shadow year, this coming year, the Alliance will be in shadow form. It won't be a statutory body. Every partner around the table is going to need to take the decisions the Alliance makes back within their own organisations before they are implemented. And this is quite a standard approach, I guess, to forming a new arrangement between partners. We need to make sure that at this stage we're running at the same pace, and the Alliance therefore can't require any partner to act in a particular way, but we hope through the relationships we're establishing and the partnership that we're forming that we'll reach common consensus on the things that we need to do to improve health. And formally, the Alliance, it's being recommended to a council executive next week that is adopted as a subgroup of this board, and that will need to be approved at full council. Decision-making accountability, as I say, will remain the purview of every organisation that's involved at the moment. It's proposed that the Alliance Board Chair will be the leader of the council, and during the next 12 months, the Alliance will need to be reviewed and its governance will need to be reviewed, which will include the relationship with this board, the Health and Wellbeing Board, and reports being presented through council, as this is a formal committee of full council of City of York Council. So we make sure that those decisions are taken appropriately. And just at the request of the chair, my final slide is a bit of a glossary, because we're very aware that partnership boards are fairly common in any health and care system. And I think until you see them set out on a page, it can be quite easy even for those of us who are probably fairly involved, for there to be some confusion over them. This page doesn't set out any form of relationship between the boards, but it just puts them down on one bit of paper and starts to summarise a bit about what each organisation, each board does. And I've separated it into the formal committees, which have that statutory function within our council's constitution, but then there are partnership boards, We've talked about the Alliance today, but we're going to hear from Emma Borton later on about York Health and Care Collaborative, which is another key body in the system. But then we have specific partnerships about ageing and about mental health in the city, operational boards like the Health and Care Resilience Board. And just in case people are a bit confused about the Health and Care Partnership and the NHS board that are along the bottom, these are regional level bodies that are going to be set up as part of the white paper reform. So that language will start to sort of appear within the system, but these are not York specific. They are part of what the Humber Coast and Vale ICS will use as its governance structure. So I just wanted to put that slide up, and hopefully will help in terms of a bit of a glossary. And Chair, I'll hand back to you because that's the slide to finish with.
Thank you, Peter. That last slide is actually very useful, I would reckon. I'm going to ask Alison to comment, and then I'm going to take questions. So if you're cooking up a question, perhaps you can let us know. Alison, would you like to comment now?
Yeah, so I'm really excited about this actually, because I've been saying for many years that the voluntary and community sector has a bigger part to play in health and care. So for me, this is an opportunity for the voluntary sector to get more involved at the beginning of designing or delivering or reviewing services rather than at the end, which is the norm. So I think it's a great opportunity for us and also for citizens to be more involved as well. So I'm thinking about people from underrepresented groups, so from BEN communities, learning disabilities, disabled, blind, all sorts of, people living in poverty. They should be part of designing and delivering services because we need to make sure that those services work for them. So for me, this is a great opportunity. And obviously I'll be working with Sian to look at how we engage citizens and the voluntary sector so they're part of this conversation. So that will be happening shortly, hopefully.
Good, thank you very much. Okay, did I talk over you? If I did, I'm sorry. Our first question comes from Bev and then Anna.
Yes, thank you, Chair. Yes, thank you. That's really interesting presentation around the plan once the CCG is disestablished. My question is to Phil around the membership. So as we know in York, the vast majority of adult social care is provided in the independent sector. And I'm just wondering around representation and offering the ICG, if that would be appropriate.
Thanks, Bev. Apologies again, Carol, for my camera. I'll just keep going though, if that's all right. Thanks, Bev. And it is a very valid point that you make, and it's one that we have been wrestling with over the last 3 to 4 months as we've been bringing forward this development. During that period, we've had requests from various sectors to join the development phase of this work and equally to join the board. It has been difficult to know where to draw a line, and we haven't finalised that by any means. But I have had conversations actively with other sectors who make the same point that you have made. As we get towards April, we will keep this issue under review. Our emerging conclusion was that the board members, as proposed on the slide we saw earlier, felt right for the development phase. However, there will be, in each of those areas of first focus, programs of work that we will have to establish. So, for example, the program of work around patients who have a complex care need will involve different sector partners in developing new models of care, new models of support, and new offers for residents. And we did feel that some contributions would be better deployed in that way than being at the board. We also didn't want to just replicate the membership of the Health and Wellbeing Board, because the two things are different. The two things are different, and I can expand on that difference further later if that would be helpful.
That has been my concern, Phil. I've asked that question several times. We'll go through the 3 people that want to ask questions, and then we'll come back to you on that one. Anna, and then Denise, and then Maxine.
Thanks, Chair. My first one's probably for you, actually, just a quick one, but would it be possible for us to share this presentation with all the elected members? Because obviously if we're going to be asked to make decisions about it soon, I think it'd be good to start being able to wrap our heads around it, because there's some quite complex changes, aren't there, coming?
Yes.
My next one's a bit more specific to the presentation given. Thank you for letting me ask the first one. So I'd like to know how much influence we think that the York Health and Care Alliance is going to have across such a geographically broad and quite sort of area with very different needs. You know, we're taking in some areas of quite high levels of health inequalities and economic disadvantage. So I think it's just, it will be good to get some understanding of how much lobbying we can do for York, because there is always that sense that York's quite affluent and that these things don't happen here. And I'd be worried that across a bigger area, our voice might be sort of drowned out. And if I could just sneak in a quick extra one, sorry, Chair, apologies for this. I'd like to know about the duty to collaborate a little bit more, and whether or not that's including sort of outsourcing to private providers, and if we're almost sort of preempting this with the proposed move of some of the A&E services to Vocare. Is that going to be happening in the background, sort of in response to what's come out in the Health and Social Care white paper?
Phil?
Yeah, thank you. Thanks, Councillor. On question one around influence, I'm going to invite my friend and colleague, Mr. Morritt, to see if he would like to answer that. If he doesn't want to answer the second question, then I'm happy to do that. But if Simon, you want to do both, that's fine. But I'll leave that to your discretion.
Simon?
Yeah, one thing to say, this is a really, really exciting proposal, and it is the right direction of travel, I believe, for us to be going in York. The one, it's not really a word of warning, but there's still quite a lot that we don't know around what is happening with the white paper proposals that hopefully you've all had the chance to have a look at. And in terms of influence, what's important is that York is able to effectively hook into the arrangements that are being established across Humber Coast and Vale. So it's able to effectively make its case effectively within the subsystem of North Yorkshire and York, because Humber Coast and Vale has been split into two subsystems, and then equally influence the integrated care system. Because effectively, if we're talking about NHS resource, and it is important to stress that in terms of the changes we are talking at this stage about NHS resource, the body with the allocative power for health resource will be the board of the ICS. So in terms of our influence, it'll be how well we are placed with that particular board to make the case for the city of York. Thankfully, many of the people who are on this call are actively involved in those developments and helping to shape that integrated care system. On the second point, and to some extent, I would have been happy to say something earlier in response to Steve. The duty to collaborate, I think, to some extent nationally, was aimed at providers, and in particular aimed at foundation trust, because one of the major public policy changes around the proposals in the white paper is effectively to disband the internal market. So that market mechanism that has meant that organisations like the one that I'm responsible for are sat across the table from organisations that Phil is responsible for to try and agree a sum of money to deliver a range of service to meet a set of needs. That system is being disbanded. The collaboration element in terms of the duty to collaborate is that effectively we're all commissioners now in the NHS. Our job will be to sit down and work together to find solutions. Now, I think as Beverly Proctor has just said, that will be about working with all partners within the system who are contributing to supporting the health and care agenda. Some of those will be voluntary sector organisations, some of those will be social enterprises, some of those will be private sector organisations, and some of those will be traditional NHS organisations. So effectively, it doesn't change the makeup of the partners that contribute to supporting the system now, but it does put a duty for us to work together to determine how we best use the resource that we have.
Yes, thank you, Simon. I've got Denise, then Maxine, then Pippa. Denise next.
Thank you, Chair. My question was mainly around the same area as Councillor Perrett's last question, really. So thank you, Simon, for the response so far. I do think that, I think that's very good that you've responded to the speaker to some extent, at least, and quite an interesting explanation of where we're at with the ICS. I think obviously to take residents along with us, which I think Phil referred to earlier on, and about involving and getting residents on board, we are going to have to be very transparent on all the aspects of what this is actually going to mean. And obviously things like improving and increasing prevention work, collaboration and integration are all very good, but clearly there are some difficult issues also about where it's going to take us in terms of who's responsible for allocations, finances, who controls what happens in York. And I appreciate that's coming from the government. But I do think it would be useful to have a bit more focus on what is happening with the A&E, because, despite what you said, Simon, it is still, as far as I can understand it, privatising more of that service. And if it isn't, then we need to explain that to the public, I think.
Do you want to make a quick response, Simon, before we have the last two questions?
I do, really, because where we are in terms of ED at the minute is that this is where old worlds and new worlds are colliding to some extent. The Clinical Commissioning Group has a contract with Vocare to deliver minor illness services. And they've had that contract, I think, until, certainly predates me, I think it's around 2015 when I think that contract was first let. Vocare also provide the GP out of hours service for the city as well. We, and by we I mean the NHS Trust, have a contract to deliver the minor injuries service and the streaming service at the front door, again with Vale of York, with Vale of York CCG. The only thing that has changed in recent months has been the changes to the national specification around urgent treatment centres, and that national specification has placed an emphasis on effectively providers of minor injuries and minor illness working more closely together, and that's what effectively it means for us. So we are not, and this is an important point to make, we are not proposing that York Trust in the coming weeks and months will not be the provider of a minor injuries service, and we will also be providing the streaming service at the front door. What's important is that we work together with Vocare so that there is an integrated offer to members of the public. So one change that will be a positive change for the public there is that when a member of the public phones NHS 111, at the minute they can be scheduled into an appointment in the minor illness service, but not minor injuries, and that will change. They will be able, if we can get a technical solution sorted out, scheduled into a specific appointment for their minor injuries. So there are no plans to commission further services with the private sector. Now, what happens after April 2022 is still for debate, because Vocare's contract was extended for a 12-month period by the CCG from the 1st of April 2021 to the 31st of March 2022. And we will have to discuss as a system how we want to progress beyond that date in terms of meeting the requirements of an urgent treatment centre as a system. So I hope that was reasonably clear.
Yeah,
Well, thank you. Thank you for that. I'm sure it's helpful. It might be useful to follow up the chair's suggestion about maybe having scrutiny, have a bit of a look for the future as well, as you said.
Yeah. Right, I've got Maxine, Pippa, and then Emma, you will be the last question because we're chopping into the time you should be talking anyway. So, Maxine.
Yeah, hi. What I just wanted to explore was how the Alliance would start to engage with education as one of the key partners, also delivering a universal service. And particularly the importance of education to improving whole life outcomes and also that angle around prevention. But also with my responsibility for special educational needs and disabilities, there is that very important alliance between education, health and care, which delivers for children and families in the city. And it's how that's going to be reflected in this new alliance approach.
Is that Simon or Peter or Phil?
I'll go if I may, Carol.
Yes, please.
So first part of your question, Maxine, thank you. So Amanda Hatton has made the same point over the last 3 to 4 months, and through the workshops we've heard the importance of a healthy start to life and the contribution of schools, and to that end it is proposed that the academies are represented on the Alliance board as it starts to form. In terms of the second part of your question, so I guess what we're trying to achieve by April 22 is to have something which can mirror the arrangements that are currently led by Vale of York CCG for the city and have been a case study in exemplary partnership working in the last year. So going back to why will the Alliance be different in governance terms to the Health and Wellbeing Board, we would hope that from April 22 it will be able to take on those delegated SEND responsibilities from the ICS and manage those in the way that currently the CCG does with City of York Council. That will be part of the developmental challenge of the next year, and making sure that we can then deploy the same expertise and capacity of staff to manage that as we currently have within the system. So we would want to keep our best people. Having an alliance gives us a chance of people being able to relate, our staff being able to relate to how we can do that, so they would want to continue to work in the health and care system in that space in York. Thank you, Carol.
Thank you.
Thank you. Pippa?
Thank you. Just thinking on Amanda's behalf, as she's not here, in terms of the relationship of the council to the Alliance, and also particularly with my focus on adult health and social care, I just wanted to comment that I think one of the things that's really positive about the proposals is that it does bring the council of City of York closer to the Humber Coast and Vale integrated care system, and it kind of enhances the engagement of the local authorities into that world. And it's part of my privilege to represent the council at the Humber Coast and Vale partnership, and this afternoon this was sort of commented on in passing, and it was really warmly welcomed that there was a suggestion that the leader would take that chairing role as a sign that we're going to be much more engaged as a system across the local authority, and not just health and social care, but the local authority in its widest role. And I think that's really important to remember, because when we're talking about health inequalities and the wider determinants of health, that isn't about health services, that's about the whole community and individuals working together to improve health outcomes. And just briefly, in relation to that duty to collaborate that's described in the white paper, of course the Care Act from 2014 placed a duty to cooperate on councils and adult social care, and there's a similar duty to cooperate on directors of children's services. So this language is evolving, but actually this is not, it's not come from nowhere. This is work that we've been doing for some time.
Yeah.
Thank you.
Right, Emma, you're going to have the last question. I'm sorry, Denise, I can't come back to you because we're 10 minutes over already. So Emma, then when you've done your comment or your question, perhaps you can go straight on to the next item, which will be rather shorter than it would otherwise have been, I'm afraid.
Not a problem, Chair. I guess the final comment I wanted to make actually was going back to the concern over the UTC. And again, just to try and support from a primary care perspective, we are very wedded to keeping NHS funding within the NHS, and we would very much like to work with the hospital and the ED department as York local general practice to make sure we have a seamless offer of care. Obviously Vocare is a third party, they do provide an out of hours contract and they have the front door, but they duplicate a lot of what we have in the system. And I think there is some co-design and potential to come forward with an integrated model that is better for our population. So just want to say, as GPs in York, we're very committed to that, and we look forward to working with Simon and the ED team perhaps on some solutions. So I think there are other ways of doing things and we're keen to explore those. So anyway, that aside, I'll move on happily. So I'm now speaking my role as the chair of the York Healthcare Collaborative. And as we presented at the last meeting I was able to go, we are very much an engine room. So we sit just below the CEO level. So we're the main directors in York running a lot of the services of health and social care. And our mission that we shared last time was to work across various prevention agendas and just to deal with, I say, our main mission is to deal with health inequalities where we can, and by bringing collaboration together. So hopefully I don't need to talk long. The report really was looking on our 4 main areas that we're working on in the York Healthcare Collaborative and how we're making progress. Probably the most recent one, just to give a brief update, because Peter's covered quite a few already, is that we're working on the councillor supported an alcohol pilot to look at more work, and Peter raised that alcohol and drinking rates have gone up through COVID, aligned with mental health issues. And that we're co-designing between general practice, the substance misuse service, the hospital, a service to try and help deal with more early intervention for drinking problems in the community. So it's a really positive piece of work across public health and all the provider organisations to make sure we meet that population health need. And really beyond that, Chair, most of the aspects of what we're doing are covered in the report. So it's more for receiving, and I'm very happy to take any questions.
Yeah, that's lovely. Thank you, Emma. And it's good to see how that links in with the priorities of the Health and Wellbeing Board. Everybody should have had this report and hopefully had time to read it. So any questions for Emma? Oh, Emma, you might have explained it all in your paper. Oh, Anna's, oh good, Anna, would you like to ask a question?
Sorry, I've been a pain at it tonight with questions. I just wanted to ask if we could hear a little bit more about the pilot for the substance misuse service, just because it'd be interesting to know how people were engaging with it and whether it's made a difference with it being online, because I imagine that's quite appealing to people as a different way of offering the service. And is that something that could continue potentially if it is working?
It's very much at its infancy at the moment, so we're really at the design phase where we've got some work to do on identification. So we're relying at the moment very much on self-reporting and a down system from people perhaps attending in crisis with alcohol. We're really looking to try and intervene earlier. So those who are problem drinkers that are contributing perhaps to their ill health, either indirect cause and harm from alcohol. So it's very alcohol focused, and we're looking at more support workers to do perhaps a 6 to 8 week brief intervention, more than that, psychosocial intervention approach, which would support and help reduce drinking and understanding it in the context of the harm it's causing. So as yet we don't have those workers, but we're, as I understand it, Changing Lives, who's the drug and alcohol support service for York, are looking to go out to recruitment, and then we're looking at placing them in strategic general practice networks across the city where we identify need, and then that support will be there. And yes, there will be evaluation sort of built in, so very happy to feedback once it's started.
I think Anna would probably think, as I do, that we need a report back on that one as that develops, because you say it's in its infancy, and obviously so, but it would be very useful if that would come back, and I'm sure Tracy will make a note of that. Right, there are no further questions. Thank you. I didn't even thank Phil for coming, but I see he's gone, so somebody will have to transmit our thanks to him. We now come on to the Better Care Fund update, which is Pippa's item. It's the second paper in your pack. And this is to look at the progress and the planning for 21-22. So Pippa, the floor is yours.
Thank you, Chair. So I hope that, as usual, the report is relatively self-explanatory, and the intention is just to give an update on the conversation we had at the board in January about the absence of national guidance around the current financial year and the next financial year in terms of Better Care Fund planning, and also therefore our agreement that we would review the entirety of our BCF plan to make sure that it's having the best possible impact and helping us promote all preventative work across the city, but also that collaboration we've talked about so much already this evening. And I think it's a really good fit for the agenda that we've already had today. And I hope Peter is still here, as Peter has been part of the review team, so he may want to comment on what he's seen through this process. So if it's okay, I'll just kind of rattle through the report. I mentioned that the policy and planning framework hasn't yet been published. It was promised early in 2021. I gather from colleagues and Sean Jones, I'm not sure if you have any further information, that there is an aspiration that they may be published before the end of March for the next financial year, but as yet we don't have that. We have been advised about the process for reporting on the current financial year, so there'll be a return to government after the end of the financial year to say how we've spent the money and to confirm that we've complied with all the national conditions. And one of those national conditions is that the Health and Wellbeing Board signs off the plan, and we previously asked for you to have that delegated authority, Chair. So because of the uncertainty about future funding that's rolled on year, we did want to review thoroughly all the schemes to make sure that we're ready for multi-year planning when that does arrive. And we've given a confirmation to all schemes that anyway contracts would roll forward till the end of June, and we're working through all schemes at the moment. Just did want to flag up that we've already referred to the white paper. One of the things the white paper talks about, so the white paper is called Integration and Innovation, Working Together to Improve Health and Social Care for All. That was published on the 3rd of February, so since our last meeting. And paragraph 9 and 10 and 11, I've just described, it does refer to Better Care Fund and the continued intentions around integration and a standalone power for the Better Care Fund, so that it will be separated from the annual process of the NHS mandate, and we should be able to plan over a longer period, or at least separately plan for the Better Care Fund from April 2022. I don't know, Chair, if you want to invite Sean, if there is anything he can add to that before I go on to the more detailed part.
Yes, okay, I will invite Sean, because certainly something Pippa and I have discussed a fair bit is people whose contracts are about to finish and are very worried if they're going to have a job. And that's just a consequence of the fact the Better Care Fund is allocated per annum, and we don't know what happens in the following year. So, Sean, would you like to comment?
Yeah, thank you, Chair. Yeah, absolutely. And I absolutely understand the practical issues that you just flagged there, which unfortunately has been characteristic of a number of occasions in previous years. I think there is an aspiration for the guidance to come out sooner rather than later this time around, in recognition of where we are. And in terms of the issues that you flagged there around contracts, I think it's reasonable to work on the assumption, as is the case with a number of other aspects of NHS funding, that we can carry that over into Q1 as a minimum. And then hopefully during that time, we'll get further clarification on the guidance for the rest of the financial year 21-22. So certainly there will be an intention for that guidance to come out sooner than later. But if you work on that assumption in the meantime, I know that's not ideal, but I think that gives a practical steer in terms of moving things forward.
Thank you, Sean. That's quite comforting, I think. Pippa, do you want to continue before I bring anybody else in?
Yes, thank you. So, and I'm certainly working on the assumption. We know that we have the next financial year, so it was confirmed that we roll forward from 2021 to 22, and I'm going to work on the assumption that the intention is for multi-year agreements in later years, because I think that will make such a big difference to our partnership working across the city and nationally. So within the report, I've described the purpose of the review and what it's designed to do, and the approach that we're taking, and the context of system-wide financial pressures, and the importance of not just building year on year in a sort of bolt-on way to the plan that was agreed in 2017, but to really do more strategic work that we can focus on prevention and population health management. So we've got an opportunity to really make a difference this year so that we're ready for next year. There are 4 phases to the review. We've already completed the first phase, which was those schemes which are very preventative schemes in the voluntary sector and in the council, where a lot of people were dependent on fixed term posts, and we have confirmed them so people are aware that their funding is continuing. We're just in the near to completing phase 2, which was the second batch of preventative schemes where some roles might have been affected by fixed term contracts, but perhaps not so many or not so rigidly. And then the third phase are all of the other schemes, which many of which represent major areas of ongoing commitment across the city, but have got ongoing contracts as an assumption. For example, the community services in the Foundation Trust are funded through this process, and nobody would be expecting us to withdraw from those in that way. So we think that the next phase 4, so we'll complete phase 3 during April after Easter, and then we'll use May and June to think about actually the longer term planning opportunities from the learning that we've gathered. So the review will give us a really clear baseline of exactly what's going on across the Better Care Fund, and using the similar or the same measures to compare all of the schemes together to think about how we describe value, what we mean by value. So not just value for money, not just about what we spend, but actually what it delivers for the city and how it's improving our prevention agenda and driving forward integration. So at paragraph 16, I start to talk about the fact that we've completed 9 reviews, and also that wherever possible, we've drawn on the existing information that providers and partners already give us. So we have a performance framework, we annually evaluate what we do, and wherever possible, we've just used all of that combined picture to think about how we assess them currently. And where there are questions or uncertainties, we're just asking them for quick responses on that, because there's no intention to add to the burden of people who are already very busy doing exceptionally valuable work across the city. What it has allowed us to do, though, is to think about how might we add even more value by working in a more integrated way or joining up opportunities, communicating between schemes, making connections. So the bullet points at paragraph 23 start to describe where we think we can do even better. So an example is joining up the health champions with health trainers in public health. Now, those relationships do exist, but we can make them even stronger and more widespread across the city. Equally, where we have services like the RATS team, which is short for Rapid Assessment Team, helping to avoid admissions through emergency department and helping people to be discharged. They're joining up with all sorts of other BCF funded and non-BCF funded schemes across the city. So just trying to make connections where we can do that more efficiently and ensure that even more people are supported to get back home instead of being admitted to hospital, where that's the right course of action. So I don't think I really want to continue too long just talking about the paper, but in essence, where we're at is that we're doing a very thorough piece of work to compare each of the schemes, to think about the meaning of value and how we can weigh up the importance and the impact of preventative schemes. It's quite a tricky thing to do. I don't think anybody's really cracked how you define the social return on investment of prevention, but we have lots of different mechanisms for doing that. And when we come back later in the year, we'll be able to give a more of a helicopter view about the whole of the Better Care Fund. Thank you, Chair.
That's great, Pippa. Thanks very much. I'm going to ask Nigel to comment from the CCG perspective, because this is not something that the council does on its own. And I'm going to ask Peter for his comments, and then I'll take questions after that.
Yeah, great. Thank you very much. And thanks, Pippa, for the report and the discussion there. I think for me, paragraph 23 and 27 really jump out as absolutely amazing pieces of work. And in 27, we talk about the value of networked, integrated, flexible approaches between organizations, teams, and local people. And that's really what we've been talking about all of this meeting. And it's so wonderful to see that. And really, we need to push on as City of York, as the Alliance, around this. And I completely agree that this isn't just a local authority thing. This is everybody's business. So thanks very much. And yeah, completely agree. There's so many different examples of best practice and good practice in here. So completely agree with that.
Thank you. I think paragraph 3 is impressive. And I know that those are only some examples. There are more. Peter, would you like to comment?
Hi, Chair. Lawrence Parkin, Webcasting Officer for City of York Council. Peter is no longer present, so he won't be able to take any questions.
Sorry, I think that's my fault because I couldn't see all the faces while I was looking at the report. Apologies.
Right. Okay, so we can take questions now. Any questions from anybody? Anna, where are you? Oh, Denise, right. Okay, Denise.
Thank you. I couldn't find my hand quickly enough. It's a fairly simple question, just the tiniest bit of background. The Better Care Fund, as over the years I've been in and out of this board, has always seemed rather mysterious in some ways, more as a member of the public rather than totally involved, as most of you are. But obviously I'm aware now that that what is in here in this paper is, as the previous person just said, a huge amount of really positive stuff, really positive things going on and being done, and collaboratively. And my question is just, I know there may be some sensitivities, but can we say more about exactly what the schemes are and what they're doing so we can celebrate, you know, just bring that together for the public when we talk about the Better Care Fund, so it's clearer what they are actually doing on the ground.
Is that a sort of expansion of paragraph 23, Pippa, do you think?
Well, I was going to be fairly direct really and say that once a year we bring an annual report to the Health and Wellbeing Board, which actually does sort of enumerate the wide array of schemes and what they've been doing and some of their activity information and performance. But it's still very hard for that not to seem like quite a dry matter. So when I can, I always try and bring somebody from one of the programmes to actually describe the work. And we've had Jennifer Allett from Age UK and Christine Marmion from Ways to Wellbeing. And certainly when Christine came and talked about the role of social prescribing, I think, you know, it really lit a fire for people and they understood the purpose of that and what a difference it makes. And I just have the sort of millstone of being a bit of a faceless bureaucrat really. So when I'm talking about what we found through the review and how we can add value, it looks quite dry on paper. Once a year we have annual evaluation events that we do. I bring people together in groups, we do that in clusters, and it always brings a massive exchange of ideas and opportunities, and people are saying around the table, oh, I didn't know you did that. Well, if you're doing that, we can do this together, and that would make so much difference. And I think one of the learning points from this process, even though we're still fairly early on into it, is that I think we need to have annual events that bring everybody together. And that doesn't mean we couldn't bring people that aren't involved in Better Care Fund, so other stakeholders could come and be part of that, especially if we're doing things over Zoom or other platforms, or we could have the annual evaluation event and sort of film and publish it so that it brings it to life for people, makes it more vivid.
Good. Before I go to Sean, when's the next one due, Pippa?
We normally do the evaluations around May. Last year it slipped to July for obvious reasons, but I'm talking about scheduling it for sort of May, June time. And I think there are colleagues who can help us perhaps record the sessions or put it into some kind of publication.
Yeah. That's something to look forward to. Thank you. Sean, you wanted to ask or speak?
Yeah, just a comment really on the previous member's comment around the mixed position around the BCF fund over the years, and it is indeed been one of those things that is felt like a bit of a chore and an inconvenience at times. But I think it's important, as you've just drawn out from this report, that we focus on the positives and the achievements that's been done. And I think the commitment to a more likely longer term funding position, as indicated in terms of white paper, will put Better Care Fund on a much more substantial and longer term footing. But I think it's fair to say that the journey of the Better Care Fund generally, but specifically in York, is in a much better place now than it was several years ago. And I think it's fair to say that officers, both within the council, CCG and elsewhere, have done a huge amount of work to get it to that place. I think it's important to acknowledge that journey, and where things are now are a million miles away from where they were many years ago.
Yes, that is absolutely true. When I took on my role in my portfolio, everybody tore their hair about the BCF. And I'm pleased to say there's no more hair tearing. And a lot of that is thanks to people like Nigel and Pippa. And I'm very grateful for that. Any more questions or comments from anyone? No, we're quite happy with that. Right, thank you very much, everybody. I must say, I think it's been a fascinating meeting. I think what is interesting to me is that we started off with all the operational stuff right across the board and still didn't have time for people like Phil Kane and Bev to say their bit. And then we went on to the big strategic stuff, which we badly need to look at because the scene is changing and we need to understand it. And I'm really, really grateful to everyone for their contributions. It's been absolutely magnificent. So unless there are any last comments that anybody wants to make, let me just ask, is there anything? Oh, Anna.
I'm back again. I'm back on form. Sorry.
Yes, go
Thanks,
on.
Chair. I was just going to ask that we don't sort of lose sight of the first speaker and coming back to that topic urgently, because I know health scrutiny is not scheduled for another formal meeting in public for a little while. I think it's May before we meet again. So I think it'd be good to try and talk about that. I think
we
even
need
just
to fit
amongst
it in
ourselves
somewhere.
in the meantime.
Yes. Yeah. I'd rather it went to scrutiny than came back to here, because I think if Simon were able to go to scrutiny and talk to them as he's talked to us, I think that would be very, very helpful. But I shall hand that over to Tracy and then chase it up to make sure it happens. Any more comments or questions from anyone? In the best traditions of Health and Wellbeing Board, we're going to finish early, which with today's agenda is somewhat surprising. But I say it again, I'm very grateful to everybody for their contributions. It's been absolutely great. And can I say thank you to everyone for coming, and we'll look forward to the next meeting. So thank you.
Thank you, Chair. Bye-bye.